the window! Passenger! U.S. Besson, we believe you may have a gun! 45.
We're on scene pretty quickly and transported that individual to the hospital where he was pronounced deceased.
I don't know what happened, really. I really don't know what happened, but we didn't see him, and I'm so sorry to hear that.
It's what I'm able to do right now because I'm homeless, and you can't, in reality, you can't really have a real job when you're homeless. You don't have nowhere to take a shower. You don't have, you know what I'm saying?
Oregon, the crown jewel of the Pacific Northwest, shines with lush forests, rugged coastlines, and a reputation as the beaver state known for its industrious spirit and boundless natural beauty. For decades, it has symbolized the American dream, drawing dreamers from across the country who hope to build a life where opportunity meets landscape. But beneath the serene veneer lies a stark and troubling reality, a state wrestling with shadows that threaten to dim its promise. On October 6, 2025, Alan Hammond, an ordinary man perhaps just passing through downtown Portland, was shot on Southwest 3rd Avenue.
We deal with like a lot of narcotics use and things like that. We are pretty used to that, but never anything this violent.
We're on scene pretty quickly and transported that individual to the hospital where he was pronounced deceased.
I don't know what happened, really. I really don't know what happened, but we didn't see him, and I'm so sorry to hear that. The fact that it only happened 2 hours ago and he already died, that's so heartbreaking.
This isn't just a statistic. It's a life extinguished, a family devastated, and a community left with yet another scar. In the heart of Portland, the streets carry more than the aroma of fresh coffee. They echo gunshots and carry the quiet despair of homeless encampments stretching along rain-slicked sidewalks. Homelessness acts as a volatile spark, igniting cycles of despair and fueling wider unrest. From opioid struggles in Pearl District encampments to financial scams that siphoned $201 million from vulnerable seniors this year alone, Oregon's problems reveal a deeper unease, a widening gap between prosperity and peril. The 2025 HUD Point and Time Count shows Oregon leading the nation in unsheltered homeless children. Roughly 18,000 people wander the streets, rising sharply from last year, while in Multnomah County, FUS 277 more individuals have fallen into homelessness in just the past year. Those tent cities aren't just temporary shelters. They are symbols of systemic failure. Have we paused to consider the children growing up in drenched tents, uncertain of what tomorrow brings?
Saying these people are at work, they can't move their stuff, so you're going to take their stuff and throw it away.
I didn't say that.
Yes, you just did. And you're going to arrest me? You're going to arrest me for not going to some fucking place?
I'm letting you talk, so wait, I'm going to let you finish.
I'm asking you, you're going to arrest me for going to some place for a misdemeanor.
You put it here.
For nothing. Because I'm homeless? That right there should be against the law.
Portland's dim streets where gunfire lingers like a ghost and the whisper of despair as constant social ills etch a persistent ache into the city's soul. Last September, 2 police officers had to respond with gunfire at a gas station in southeast Portland, a lawful act that still left the community reeling. Robberies from the July bank heist in Oregon City to the armed robbery in McMinnville on October 6th, with the suspect held on $1 million bail, highlight a society teetering on the edge. Homeless encampments stand as a grim feature of this landscape, a mix of makeshift tents and desperation.
You especially, we believe you may have a gun.
They are not just homes for the forgotten, they are gray zones of crime. Crime and homelessness feed each other. Take the fentanyl heists in Portland's tent communities, where perpetrators have received 18-year sentences. These incidents underscore a vicious cycle. Homelessness breeds crime, and crime worsens instability for those already vulnerable. Portlanders share their fear on X, worried about safety near shelters, and it's easy to understand. The shortage of beds, around 2,000 available for an estimated 6,000 people in need annually, leaves the streets a breeding ground for violence. Currently, Oregon counts around 18,000 people homeless in America, many of them unsheltered, with Multnomah County alone adding 277 new cases last year, while only 865 managed to find stability. In Portland, tents appear like weeds in city corners, shelters for the mentally ill, the addicted, and those battling systemic neglect, painting a heart-wrenching portrait of isolation. The rate of unsheltered homeless children is the highest in the country, 19.9 per 10,000 children, 14 times the national average. How can we allow the next generation to grow up in such peril? Refugees and migrants add another layer of complexity as newcomers chasing the American dream encounter brutal housing shortages. At the root are skyrocketing rents, widespread drug addiction, especially fentanyl, and weak local policies offering minimal healthcare counseling or job training. Still, society keeps blaming individuals instead of confronting a system riddled with gaps, leaving countless people trapped in cycles of despair. Homelessness in Oregon isn't a new phenomenon, but the factors driving it today are urgent, complex, and interconnected. Why are so many individuals forced onto sidewalks, into makeshift tents, or into overcrowded shelters, despite the state's resources and programs designed to help? The answer lies largely in the devastating impact of drugs and untreated mental health issues. The fentanyl epidemic has wreaked havoc across Portland, ensnaring individuals in cycles of addiction, unemployment, and homelessness. Many people cannot hold steady jobs or pay rent because addiction drains every resource, leaving them trapped in a relentless spiral. Mental illness compounds the crisis. Conditions such as depression, anxiety, and post-traumatic stress disorder often go unrecognized and untreated among the homeless. These struggles make it nearly impossible to maintain stable employment, housing, or even basic social relationships. Without proper access to mental health care, individuals are left to navigate their challenges alone, often in environments that worsen their condition. Skyrocketing rents make an already dire situation far worse. In Portland, average rents have climbed roughly 25% in just 5 years, while incomes have barely increased by 10%. Working families and low-income residents are priced out of neighborhoods they've lived in for years. This widening gap between the haves and have-nots has fueled a dramatic rise in the number of people homeless in America, pushing thousands further into instability. It is crucial to understand that homelessness is not a reflection of personal failure. This is a failure of systems, policies, and social support structures. It is a failure of empathy, leaving the most vulnerable to face the battles in their minds while society turns away. Every person on the streets is a reminder that Oregon, despite its wealth and resources, has left many behind. Addressing homelessness requires more than temporary shelter. It demands integrated solutions that tackle addiction, mental health, and affordable housing, giving people the chance to reclaim stability and dignity. The issue of women and men who are homeless in America, particularly here in Oregon, is far more than a social problem. It is a challenge to the very conscience of our communities. Every day, residents in Portland and throughout the state witness the steady growth of makeshift tents along sidewalks and alleyways where individuals struggling with homelessness can only carve out fleeting moments of safety, privacy, and dignity. These encampments are more than just spaces lacking proper shelter. They are microcosms of suffering where people endure illness, chronic stress, and the constant reminder that society has largely forgotten them. Can we truly remain indifferent, knowing that roughly 1,500 people in Portland alone are forced to survive on the streets every single day with no roof over their heads and no certainty about their next meal or night's sleep? Public health suffers tremendously under these conditions. Sanitation is minimal, and outbreaks of infectious diseases, including hepatitis, tuberculosis, and scabies, are increasingly common in these areas. Homeless individuals become especially vulnerable to illness because they lack basic hygiene facilities, regular medical care, and protective shelter. Their weakened physical state leaves them exposed not only to disease, but also to the harsh elements of Oregon's unpredictable weather. On top of that, drugs, particularly fentanyl and other opioids, tear through these communities, worsening both physical and mental health, while also fueling addiction cycles that make it nearly impossible to regain stability. Mental health issues often left untreated compound these challenges. Many individuals experience depression, anxiety, and post-traumatic stress, which hinder their ability to seek work, maintain relationships, or navigate the complexities of daily survival. The social impact doesn't stop with those living on the streets. It ripples outward, affecting entire neighborhoods. Crime, theft, and violent incidents are on the rise, leaving residents feeling unsafe in areas that should provide security and community. And it's not only the public who are at risk. People experiencing homelessness are often targeted by criminal networks, predatory behavior, and exploitative schemes, further entrenching their vulnerability. Can we truly call a community fair and just when its most desperate members are left without meaningful support or protection? Oregon's homelessness crisis cannot be ignored or swept under the rug. The homelessness problem in Oregon, particularly in Portland, is more than a housing issue. It's a full-blown humanitarian crisis. Even though programs and support policies exist, their impact remains far too limited compared to the magnitude of need on the ground. Initiatives like Housing First, which prioritize getting people into stable housing before addressing other challenges, represent a critical step forward. Still, while Housing First has provided roofs for thousands, it doesn't come close to meeting the needs of the growing population of people homeless in America and urban centers. The city has also invested in affordable housing and temporary shelters, but resource shortages and heavy dependence on nonprofits make these solutions feel precarious at best. The truth is, even with short-term shelters and medical services, mental health struggles and drug addiction create enormous barriers for those trying to regain stability. Can we truly help these individuals if we don't tackle the root causes like untreated addiction or serious mental illness? Current efforts fall short of breaking the cycle. Budget constraints remain a major obstacle to developing long-term comprehensive programs. Demand for housing, healthcare, and mental health support continues to climb, yet government and nonprofit resources lag far behind. Even when cities like Portland try to respond, projects often face delays or worse, collapse entirely. So what can be done to turn things around? How can government agencies and communities implement solutions that truly improve lives rather than just managing the problem? Fragmentation in the support system adds another layer of difficulty. Local governments and charitable organizations often operate in silos, creating gaps in services and delaying assistance to those who need it most. Many individuals fall through the cracks because support isn't comprehensive enough to meet the complex needs of people homeless in America. This only deepens feelings of despair and abandonment for those living on society's margins. Perhaps it's time to rethink the approach, double down on long-term solutions, from increasing permanent housing options to providing full-spectrum mental health and wellness support. Maybe now is the moment to move past short-term fixes and embrace strategies that empower individuals to regain independence, stability, and dignity. Each person homeless in America is more than a number. They are a mother, a father, a veteran, or a child whose story deserves attention, compassion, and action. The question remains, can we muster the courage to confront the reality of homelessness, to see beyond the tents and the statistics, and to create a society where no one is left to face the streets alone? Our collective humanity depends on it. Why do we keep seeing homelessness surge forward, despite the significant efforts from government agencies, nonprofit organizations, and community programs? One of the biggest reasons is simple current measures aren't addressing the root causes. It's difficult, even heartbreaking, to admit that so many people homeless in America are receiving only temporary support. Shelters, short-term assistance, or crisis services can provide immediate relief, but they do little to break the long-term cycle of instability. Without access to programs that address mental health addiction and economic barriers, many are left to repeat the same struggles day after day. A promising approach gaining traction is the development of sustainable housing models. Compact housing projects, often referred to as tiny homes, offer more than just shelter. They provide a secure, stable environment that allows individuals to begin rebuilding their lives with dignity. These models have shown measurable success in cities like Eugene, Oregon. There, tiny home communities not only provide safe living spaces, but also integrate comprehensive support job training programs, access to healthcare, mental health counseling, and social services. Residents are offered a path forward, not just a temporary roof over their heads. Could initiatives like these become the blueprint for the rest of Oregon? Advocates argue yes. Programs that combine housing with life skills and professional support give people homeless in America a real chance to regain stability. They help residents transition from surviving day-to-day on the streets to pursuing long-term independence. However, achieving lasting results requires a far more comprehensive approach. The government cannot simply pour more funding into housing programs alone. Investments must also address healthcare, particularly mental health services, and addiction treatment, which are critical in communities hit hard by fentanyl and other substance crises. Policies should foster collaboration between public agencies, local businesses, and nonprofits. By leveraging resources, expertise, and community networks, we can create stronger public-private partnerships that tackle homelessness at its core. Yet despite these promising models, current measures still fall short. Skyrocketing housing costs continue to push working families into instability. Social inequities, gaps in mental health services, and bureaucratic red tape prevent vulnerable individuals from accessing consistent care. Old policies are showing their limits, unable to keep pace with the growing challenges. The real question we must confront is this: are we ready to admit that sustainable solutions require a complete rethinking of our approach? Homelessness isn't just a housing problem. It's a societal issue tied to economic opportunity, mental and physical health, and social support systems. To genuinely help people homeless in America, we need policies that address these root causes. We need long-term housing, robust mental health care addiction, support job training, and community engagement. Only then can we hope to break the cycle and restore hope to those who have been left behind. The challenge is daunting, but the alternative, watching more lives trapped in instability, demands action. If we truly care about our communities and our collective future, we cannot settle for temporary fixes any longer. When I think about Portland's streets, once lined with leafy trees, now scarred by invisible pain, my heart grows heavy. Social issues in Oregon, from isolated shootings to petty theft, have improved somewhat, with murders dropping 51% in just the first half of this year. Yet these shadows still linger, clinging to overcrowded tent camps, where those homeless in America try to survive. Around 18,000 people roam the streets of Oregon, with Multnomah County alone seeing 277 new cases in just the past year. The most heartbreaking reality: the children. Oregon leads the nation with unsheltered kids at 14 times the national average, a stark stain on our collective conscience. The link is clear: homelessness fuels crime, and crime pushes even more people into homelessness. Even in these tough circumstances, we cannot remain idle. We must expand shelter capacity beyond the current 2,000 beds, invest in programs that fight scams that have already drained $201 million this year, and reignite the neighborly spirit that Portland has historically embodied. Have you ever considered that a single act of kindness from a neighbor could save a life?
You guys,